Okay, so welcome everyone. Today we have Nolan Blodgett with us, and Nolan is going to share about counseling with trans folk. So Nolan, what's your background and where do you work?
Thank you. Yeah, my name's Nolan. My pronouns are they, them. I'm a registered social worker. I work at Women's College Hospital in the trans surgery program, and I'm also a private practice psychotherapist.
So we're going to talk about trans issues and what other counselors may find helpful when dealing with trans clients. So with that in mind, what's your approach to building a positive therapeutic relationship with your trans clients?
hmm I think it's so important with queer folks, especially trans folks, to be aware that from the beginning they're kind of coming in with a whole history of likely negative and probably traumatizing experiences in the healthcare system. And so, unlike some other populations where our clients might be, kind of coming in with a blank slate, often trans folks are coming in with all kinds of preconceived assumptions or expectations that this might go negatively or they may be harmed. And so, I think it's important that we remember that as the provider, we're kind of representing the health system that we're working within. And we're just essentially like an entity of this harmful system that's been a really a negative part of their lives. And so from the outset, I think it's really important to name that and to bring that into the work. So often when I'm meeting with someone for the first time, I'll ask about their past experiences in healthcare, what that's been like, if they've been to therapy before, and in most cases, there's some kind of negative story they have to tell. And so then I'll bring it into the awareness from that first session. I'll say something like, well, that must have been really difficult. And I imagine that's going to make it hard for you to trust me. And then we can kind of, from the very beginning, start talking about what that might look like, what might be, where that might get in the way of our work. Um, and I think, sometimes clients are very aware of that, and other times clients come in and they're what we like imagine as sort of like difficult clients without really being aware that it's a traumatic sort of response that they're having. And so it can manifest in all kinds of ways, like clients that come in and are very like combative or hostile or resistant. It's a protective mechanism that's showing up where they're if I don't engage, then I can't get hurt, right? But that might be happening subconsciously, and they might not really be aware of why they're coming in and they're having that reaction. So I find that from the very beginning, kind of giving them the tools to understand that this is probably why you're, having difficulty building relationships with therapists, or this is why you're having these behaviors, and we can sort of I like the phrase like if you can name it, you can tame it. So you can kind of like get control over this thing instead of letting it be this unspoken thing sort of lurking that's getting in the way of the work. We can really bring it into the center of the work. And I think it's important to like give them the tools and the psychoeducation to, recognize in themselves, oh, I'm noticing that I'm starting to, want to avoid sessions, like I'm wanting to cancel, or I'm feeling like I want to challenge you all the time, or I'm feeling annoyed with you. And then if they know that that might be a trauma response, they can open up that discussion rather than feeling like they just have to leave or just stop accessing care.
Okay, so it's really a proactive approach in naming that this is a potential issue that the trans folks may have experienced and probably have experienced knowing how our healthcare system works. And that, like you say, by naming it, it gives the potential to sort of tame it. And some clients may come in aware of how they've been traumatized by the system and how it may impact their relationship with you, for instance, or any other therapist. But I'm also hearing that some folks may not be quite so conscious. And so part of your task is to sort of bring that up to their consciousness and help clarify that. And then that can help them sort of recognize when they've been triggered inside a session and be able to name it at the time.
Exactly. I think, often folks just go through repeated experiences of having therapists like, leaving them or terminating with them, and they don't always understand sort of what's gone wrong. And so being able to look back at those and say, well, what happened? And then they might identify, like, for example, something I hear a lot is, well, I shared something really big and we were just getting into the work, and then I just decided I wasn't going to go anymore. I just stopped going. And that's really common. If you disclose something and you open up and then you feel vulnerable to just sort of run away. It's a flight response. So kind of naming that for them, it gives them more control and more power to feel like if they notice that pattern again, they can work with it instead of letting it sort of run the show.
So, given that trans folks are immersed in a society that is predominantly and in a healthcare system that has historically predominantly had negative attitudes and treatment towards trans folks, and so some trans folks may have internalized a lot of that shame. What's the approach that you and your clients find helpful in dealing with internalized shame?
Internalized shame is huge with any marginalized population. Um, I think it's so important to really situate your client within the context of all the environments that they exist in. Unfortunately, like some therapeutic modalities really focus a lot on the individual and them changing their behaviors and their thoughts and their feelings. And it can, like, if we're not careful, then those modalities sort of neglect to notice the other impacts of these like social forces that have been playing a role in the internalized beliefs and thoughts that our clients are struggling with. So I think it's really important to be able to kind of locate, when we have a belief or a thought that's really distressing for someone, locate sort of where is that coming from? Where did you learn that, right? So I'll often have trans clients say, well, I've always hated myself. I've always felt like I'm unworthy, so I'll let them know, well, you weren't born feeling that way. So that message came from somewhere. Let's try and figure out where you found that message, right? And are you still being exposed to that message? And so often people are, every day they're going out into the world and in various spaces, they're being exposed to beliefs that trans people don't deserve rights or don't deserve healthcare or aren't respected. And so it's not going to be that effective if I get them to change their individual belief and say, oh, okay, well, I'm worthy, when they go out in the world and there's all this contradicting information that actually a lot of the world doesn't think that they are. And so we focus a lot, instead of changing that belief, on kind of externalizing it and placing responsibility where it's due. So being able to acknowledge, like, okay, some people might think that trans people are unlovable or unworthy, but that's not mine. I don't have to carry that belief. It's that belongs to society, that belongs to, my parents or whoever it is that's been sort of introducing this message into their life, or that's a product of this oppressive system, and they can kind of locate that outside of them. So when that internalized shame gets activated, instead of trying to change the belief, they can just say, okay, that belief is not one that I have to hold. I think as providers, we have to just be really critical of the modalities that we're using and making sure that we're not placing all the responsibility on that individual trans person to change how they feel and what they believe. And we're understanding like the complex systems that are at play in them shaping how they see the world and how they feel about themselves.
Wow, that is such an important point. Yeah, that the person sitting across from us or in the Zoom room with us isn't an entity that is not influenced by the society and the context around them. And
Mhm.
so by not taking that into account, we're not doing as good a work as we possibly could.
Exactly.
So you mentioned about some of the modalities that may prevent better quality counseling for trans folks.
Mhm.
And I know that sometimes it takes trans folks a while and numerous other counselors before they get to you. So, what are some of the challenges they've encountered with other counselors who may not be so up to date on trans issues and challenges?
Yeah, it's a great question. I think one of the key things I honestly hear the most often is that providers are sort of putting like the wrong sort of emphasis on why trans people are coming to counseling. So, often trans folks come and a provider will put all of the focus on you being trans and being queer and the oppression that comes with that. And I mean, as I just spoke about, it's important to locate that oppression and work with that and bring that into the work. But sometimes people want to come and talk about something that has nothing to do with being trans. And I mean, I think if we look at, as we're all trained as therapists, look at all the systems and all the identities that intersect in a person's life, we don't want to magnify their gender identity as any more or less important than any other part of their life. So, yes, this person's trans, but they might also be a person who is racialized, might also be a person who has stress at work. And these things are not all necessarily related to them being trans. And so I think sometimes folks actually come to me, a trans provider, because they want to talk less about gender. They want to be able to say, no, gender has nothing to do with this. And sometimes therapists that are not as comfortable with the nuances of gender identity think everything must come down to that. That's so big, maybe because they're curious about it or they don't understand. And I don't think it's our job to understand it all and to know when it's relevant and when it's not. It's our job to listen to our clients. So it's we need to be willing to be corrected and to have a client say, hey, that has absolutely nothing to do with being trans. You're wrong, right? We need to be okay with that. And we also need to be able to ask ourselves and be really self reflective and just say, am I wanting to know this because I'm curious, or am I wanting to know because I think it's actually going to be helpful in their care? Our clients aren't there to educate us on trans stuff, they're there to access service. And so we need to look to our clients and collaborate with our clients so that they can guide us and they can use their agency to tell us this is where it's important and this is where other parts of my life are more important.
Wow. So yeah, that premature focus on what the therapist thinks the client is going to talk about or what the issue is. And so you really gave a key question for counselors to ask themselves. Is this about my curiosity or is this about the client's issues? And
Mm-hmm.
being able to discern that and, as you say, and listening should be able to take the counselor down the right road, which is the road of focusing on the client's needs and not your own curiosity.
Mm-hmm. Absolutely.
Well, Nolan, this has been so edifying. I'm sure there'll be lots of folks who will try to reach out and connect with you to learn more. And if they wanted to connect with you on social media or through a website, how would they do that?
Absolutely. My website is nolanblodgettpsychotherapy.com. And you can reach out to me through there. My email and all my contact information is listed on there.
Great. Thanks so much, Nolan. Have a good day.
Thank you.